Welcome back to Therapy Thursdays. Today we're going to talk about manual therapy, specifically joint mobilization in the treatment of acute ankle sprains. So we've got Sean here, trainer from SST, sprained his ankle 2 weeks ago playing rugby, typical twisting mechanism, and we've diagnosed him with a lateral ankle sprain. Ankle sprains are one of the most common injuries we're going to see walking into our clinic or any sports medicine clinic. And there's been a lot of research and effort put into studying the best way to treat this. Recent systematic review, meta-analysis of systematic reviews in the British Journal of Sports Medicine showed that there's strong evidence to support getting people on their feet as fast as possible and also using joint mobilizations to assist that process. And that's an approach we've been using for quite a while in aggressively getting people back on their feet to introduce a loading program. So first of all, you can take a look at Sean's ankle here, Pete, just zoom in. Still a little bit of swelling left. We've been using this approach for about 2 weeks, as I said, and Sean's doing really well with his rehab. So we've got Sean on his back here. We're going to start with a mobilization in this direction, trying to improve range of motion in the dorsiflexion and plantar flexion range. And this is targeting the ankle mortise joint. This is an easy mobilization to introduce very, very early on. In fact, we did this day 2 post Sean's injury. Really doesn't stress the lateral ankle ligaments at all, and it's going to help improve his ability to get on his feet, minimize pain, and start to reduce the swelling that'll inevitably be there immediately after the injury. Second mobilization, get Sean to lie on his left side here for me, is directed towards the subtalar joint, and for the purpose of the demonstration, I'll stand on this side. Generally, we find that most of the restriction post ankle sprain is going to be on the medial side or inside of the ankle in this direction. So we're trying to mobilize and open up that joint like so. So these would be the two most common mobilizations. There's a ton of variety in how to do these mobilizations. These are probably just the two that we use most commonly. On your back, Sean. The last one, about 5 to 7 days post-injury, we will also want to be mobilizing into the direction of the injury. So again, Sean's was a twisting mechanism. If we take him far enough here, we're going to recreate his discomfort on the lateral side. And we do want to, and have been, mobilizing into the direction of discomfort. And that's just going to aid the healing process of that injured ligament. In some cases, when additional stimulation is necessary, if we're finding the joint still restricted and having difficulty with the mobilization shown, we may do a drop piece with the toggle as demonstrated here, or with the belt as shown here. So in summary, if rest has been your approach to managing an acute ankle sprain, you may want to reconsider. There's really strong evidence to A, getting people back on their feet as fast as possible, and B, using joint mobilizations to facilitate that process. We also find that joint mobilizations are a great way to get people back into a progressive exercise and loading program. And that same article we referenced earlier from the British Journal of Sports Medicine also indicated that a progressive loading program is the most important prevention factor for limiting chronic ankle instability in the future. Thanks for following Therapy Thursday. See you next week.